Welcome everyone. You're listening to the ICCA India podcast. Through the podcast series, we hope to bring out multidisciplinary dialogues by discussing the intersections of economics, policy, and cancer.
Welcome everyone. This is the next session of our Innovation for Cancer Care in Africa project podcast. We are part of the India team and we are very, very happy today to have a dynamic duo who work at Icarus Design. We will have a chance to get much more into what they do. But as you know, with this podcast series, we are really trying to open up the conversation about what goes on in Indian innovation. What should we think about as innovation? What kinds of industry or design issues are under consideration? And what implications does this have for the improvement of cancer diagnostics, treatment, or other perspectives on cancer research? So welcome both Sapna and George today. And I want to first say we're quite excited about having you on this podcast. But second, also that our audience today is going to be made up of very many different kinds of people. So welcome both of you.
Thank you.
Thanks, Smita. Thanks for inviting us over. I'm Sapna. I'm founder partner of Icarusnova. I come from an engineering background and then post that design background. And we've been in practice for almost 25 years now. Last 7-8 years, we've been focused on design-led innovation, specifically in the healthcare and medtech space.
That's great. George, do introduce yourself.
Yeah. Hi, I'm George. Along with Sapna, we founded Icarusnova, like she said, in sometime in 2014. Before that, we were mainly a more broad-based design company. But, because of the years of experience before that, we began to clearly sense that design in the medtech and in the healthcare space needed very specific capabilities from our side, and that it was an area which could not be generalized. So that's the point at which we thought that, we will formulate a new company which would bring altogether new capabilities in this field. And that's how we got started with Nova. And we find ourselves in a space now which is extremely exciting in terms of the direction it is taking, all the new possibilities which are emerging because of new technologies and business models, and the intense collaboration that we see in this field. So it's been a nice experience to have been validated that there's something special to be done in this space.
And coming back to Sapna, did you think when you were making this transition, was it very clear that there was a niche that you were moving into?
So, Smita, like George mentioned earlier, we have been practicing design for almost 25 years now. And the earlier days were sort of, like just providing aesthetic skins to stuff. And we were typically called enclosure designers. And the nature of problems that we were solving were very, very superficial and very aesthetic in sense, just aesthetic in sense. But somewhere in the mid 2000s, we kind of got introduced to this whole innovation kind of ecosystem in Bangalore, and we started to work with a lot of startups who were coming up with exciting new ideas. And being designers, we always wanted to kind of start working on meaningful things and sort of get involved in problem solving right from the beginning. This really sort of gave us an idea of what could be the future. And serendipitously, much of what we did in those years were all in the healthcare space. And soon we started understanding healthcare itself and found that there are big challenges to be tackled. And we found that very exciting.
George, do you want to add anything there?
Yeah, I think one thing I could say, Smita, is that, by definition, we are a consultancy. So I think our work directly, in some sense, reflected the concerns of the business and technology ecosystem around us. Clearly, we've seen a transition from where around us there is also a huge awareness that, this answers to the medtech and healthcare industry are not, need not be received answers, but are things which could sort of be explored, be understood in a new way, seen with fresh eyes, and all kinds of things have added to it. Of course, as you know, first of all, the massive changes in technologies that we've seen around us. Second, the rise of startup cultures around us, which have, made people that much more risk-taking altogether. And I think probably the most exciting thing for us has been that these changes have brought together a completely different, we would say, consciousness in patients themselves, that they're not simply passive receivers of healthcare, but that they are people who can be empowered and who have the possibility of actively contributing to their care.
So you, in a way, just bridging a little bit of what you both said, on the one hand, clearly you are moving into quite a niche area when you began, certainly, which has required also active engagement from you in defining a much wider market, right? So for anyone coming in today into this sphere, they're also going to be seeing this as the received wisdom to some degree, that this is that bridge, it is possible. Something that you perhaps did a little bit of active stitching together at the time you came in. So, Ojasvi, you have some questions.
Yeah, sure. So this is a question on innovation, and it is often seen that many people, they use the word innovation much often, and they have different definitions of innovations in itself. So since you come from a background which involves both design and engineering, and this is a new space which you're catering to, so I'd like to ask you what you mean by innovation, and if you could give some examples which you've seen around you. And right, so that's my question.
So in the most basic sense, I think for us, and generally, innovation just means, the appearance of something new. I think that's the irreducible quality of innovation, that it is new. Now, that immediately also brings up the question of, therefore, a knowledge of what is the state of art, therefore, what is currently there. The possibility of, seeing something in the future which can become a solution, and then having some kind of strategies, tools, methodologies, whatever you may call it, in order to be able to visualize that in some concrete sense. So apart from saying innovation is new, probably innovation also means that, it includes the ability of bringing tangibility to the kind of thoughts that we may have about the future. So in that sense, that's how we think of innovation in a very basic way. But where we see, the close alignment between innovation and what we have as a practice, or what we practice as design, is that we think that design brings a very practiced set of strategies to innovation by bringing a powerful, imaginative and synthesis quality to innovation, which is often missed out in what we may call as structured innovation. So the future always involves risk. The future always involves imagination. The future always imagines a certain level of creativity in order to be able to comprehend what is yet not there. So this is, in a sense, a very something which is very well practiced from the area of design. So that is a very powerful strategy which can inform innovation. The other aspect is probably more philosophical, in the sense that design always has contributed an extremely empathetic view to innovation, which closely connects to, who you are doing this for. And therefore, it resides in a area where you are not innovating maybe purely technologically, which is also possible, but brings a focus towards who are you doing this for? What may be the way in which, this could be made easier for somebody else, and you're trying to answer those questions as a primary input to innovation. So that brings in, a second powerful aspect to innovation. And finally, because of what I said earlier, that it brings in a powerful synthesizing concept, we are able to, in the new areas of work where people are really trying to innovate completely afresh, we are able to bring together concerns of business, concerns of technology, and at the same time, this empathetic understanding to the people, the stakeholders, whether it's doctors or whether it's patients or whether it's the system which wants to use it. We're able to bring together not in a mechanical way, but in a way in which, it synthesizes or it creates a new solution in some sense.
Yes, and as a follow-up question, I'll ask, what examples of innovations have you seen which have catered to reducing the challenges which people have been facing in this whole ecosystem of healthcare? So,
the nature of problems that we are trying to solve now are way, way, way different and way more challenging. I think at a very high level, this while it's very cliched, but this whole idea of improving accessibility, affordability, and availability to people is something that is sort of guiding this entire innovation ecosystem. So in this, with this high umbrella objective, there are many things that are going on, many trends that we are seeing, and many things that we ourselves have, been fortunate to work on. So if I can talk about this entire connected devices, which is no longer are devices, dumb devices by themselves. Practically, all of them are connected to the cloud, and there is this whole ability to have a portable device doing as much, portable small handheld device which is able to do as much as what earlier big huge static equipments could do, but could be given to a sort of a minimally trained health worker who can actually go door to door and provide a small service, and then that could probably get through telemedicine, get connected to the experts who can give. So this whole area of connected devices and a complete service that sort of is emerging around that, and this is very clearly one significant trend that we are seeing. Another significant trend or innovation, theme that we are seeing is actually what we call new users. So the technology is already there, but we know this typical, problem of emerging countries of this population versus clinicians ratio being very skewed, and therefore that puts a huge pressure on the clinical system. So those are some of the innovation areas that I just thought we could talk about. Yeah.
Thanks so much for those. I think they really give us a sort of a flavor, I think, for listeners, particularly those where they might not be in an especially dynamic city. Is there a reason Bangalore is a base?
Over the years, the background definitely everybody knows. In some sense, Bangalore emerged as a kind of a technology hub primarily in the beginning. But we also believe that it also created a lot of wealthy people here. And these people have also wanted to look at new business models and new areas of opportunity, and culture of a lot of younger people who have, because of the excitement of technology, because of these stories around, what can be done and the emerging capabilities. I think Bangalore's attracted and been a home to a large number of people who are excited from many dimensions. So technology being one, business being another, specifically in the area of healthcare, a lot of excellent institutions which are already in Bangalore, which seem to have, doctors being such an important part of the innovation system, where so much of what we have done has emerged, from the clinical space. We changed around or thought through differently, both from the aspect of technology or from new ways in which, people can come together to put something new. And of course, from the government and from private equity, there has been a lot of interest.
One of the points I think George was very eloquently making was that this interactive space, which you really inhabit and claim in the work you do, requires a community of people such as clinicians or patients at different speeds who recognize perhaps that they not only have something to offer, they have a unique way in which they view the problem. And it's the combination of all of these facets that you end up seeing an opportunity, right? Because they don't quite fit in a traditional way. Talk me through the challenge that many people point out, that by and large, doctors aren't extremely well trained in India. So this may not be exclusive to doctors. It may be the wider question of clinical training and paramedical training as well. But it's clear that at the level of business and design that you are involved with, you are seeing a very highly skilled and committed group. But if we had to kind of go back to this broader question for the country, what are the implications of this? Do you see a gap in the way people are trained? Do you see a problem with the quality of the average doctor or A&M, or where is the real problem here? Because on the one hand, technology is helping us solve certain kinds of problems that are gaps in other areas, such as people's skills, the way in which the bureaucracy works, or the way in which certain kinds of patient-centered healthcare services work. So I'm asking a broad question, but it feels like you and George both have a sort of unique perspective on this.
So we've had experiences of all kinds. And to be very frank, we have on one extreme, we have worked with doctors who are, I would say, even better innovators than us. And on the other extreme, we have had people who are sort of extremely, very sort of wedded to the way things are, and kind of extremely big sticklers for the protocols that need to be followed. And you have a spectrum of people that you need to deal with. But having said that, it's a lot to do with how you kind of engage with them, because over a period of time, we've kind of started to build relationships with a lot of people. We have worked very, very closely with a couple of individual innovator doctors we have worked very closely with. What's happened is, I suppose their training is highly focused on the clinical side. At best, they can highlight gaps and need areas, and they may not have enough tools to sort of engage with the process of innovation beyond that. And, so one thing we have seen is that our process and our methodology kind of helps a lot in engaging the various stakeholders. And we immediately kind of work out solutions, in the sense that we come up with a bunch of ideas, and it is all ideas which are tangible, understandable. It's not a description of an idea, but an idea with a form and a shape and a something that if you do this, it can do this. That kind of approach we have. That immediately sort of helps them to engage in this process of saying, oh, okay, this is what you mean, and this is how you see it going forward. It's possible that all of it will be trashed, in the sense that it's just a starting point. But we've realized that this kind of a methodology sort of helps people engage in the discussion and engage in the process of sort of developing an idea and seeing where it goes. Again, just to illustrate this ultrasound project that I was mentioning, it was actually for the Indonesian market. So it was for midwives, and there, it's a culture to have deliveries through midwives and not to go to hospitals. We didn't know much about what's going on there. We didn't know much about midwives. We didn't know, what are the practices and norms, and what would be the barriers to adopting a device like this. But what we did is we sort of had some mock-up clinics here, and we got in an expert from the client side, and we sort of worked a lot of scenarios together, and we actually made a couple of mock-ups, and which sort of simulated the whole idea of what the solution could be, and used those mock-ups. With that, we went to Indonesia and we kind of did the research there to evoke and involve and co-create the idea. So one of the things that we have found very effective is to use a methodology like this. Mm-hmm. So that's a broad sort of a response to your question.
No, but I have two sort of follow-ups. One is actually to return to George and the point he was making, which is that the investor as well as the government community that recognizes perhaps not only that the combination of healthcare needs and sort of the medtech space are both opportunities in which to bring a range of people to the table, consider viable business funding, provide certain kinds of supports. And for a company like yours, what is it that the funding helps you do the best? Is it in that early conversation and prototyping? Is it the scale-up issue? I know you're going to tell me it's a little bit of all of these things, but it would really help, I think, for colleagues and communities that are not in a space like Bangalore to appreciate what it might mean for strategic investment when the problems are fairly well recognized, but the particular mix of actors don't just automatically emerge. So, George, if I could ask you this first.
In a sense, I think the funding, the main question of funding is who it's going to, And in our case, very honestly, Smitha, I would say that, since we are a consultancy, it's only when, we took that consultancy hat off and tried something on our own where, we also woke up to what funding could do to some venture like that. So otherwise, our business model is very clear. You have a problem, you pay us, and we respond. But it's only when we, in some cases, and we have not been able to do that many times, but it's only a few times where we took off our consultancy hat and said, we have a couple of ideas, and we would like to then take that forward, and we don't have the money for that. At that point, the funds which were available gave us a huge starting point in terms of being able to take those first baby steps from very basic concepts to real investments, which require considerable resource in order to take the next step forward. The reason why I'm saying that is that, it seems to be evident that the distribution of good ideas and, the people who really want to take it out into the market, there is some inequality there. And, often people who have the ideas and who also have the need or the attitude to want to do something about it are also cash trapped. The fact of government money, especially, which comes with, in many ways, not so many strings attached, as opposed to maybe private equity, is a huge encouragement for the first step of innovation, which really is to be able to answer the question, is this just a good idea, or is this one step more closer to, I wouldn't even say market opportunity. Market opportunity is probably two steps further away. But does this even have a gap? And where is that gap? And to answer that gap, what may be the first shape and form that this answer or this innovation could take? So early stage funding there is, nobody else wants to fund that,
You're raising an important point I want to push on a little bit more, because I think this is, there is a kind of a mismatch when we think about health policy priorities in most countries, whether they are rich or poor, whether they are somewhere in the middle. The reality is the priority setting process for policy design is quite divorced from resources. There's no automatic mix, right? There are regions and countries and states that have much less but do much more. So what is it about that early stage funding that could be either seen to its end, in the sense of the end goal of health impact, versus perhaps encouraging firms to specialize and hand off to other ecosystem actors, right? After all, you might not want to be doing everything in some vertically integrated fashion. You might be really wanting to do what you do best. But if you can't hand off, you're kind of stuck. And at the end of the day, someone else might ham-handedly take it on. So talk me through that a little bit, because I think for Ojasvi, myself, the rest of our team, these are the issues we see as across the innovations we look at. The failure modes are quite dramatic. And while policy-generated interest in funding is often, as you say, no strings attached, the question is, or few strings attached, maybe the question is, well, should there be a mode where there are more strings attached? Maybe that's later. So, yeah, that would be helpful.
Yeah. In the area of our interest, Smita, clearly the big innovators are the big companies at one level. They have legacy products, they have legacy systems. They're trying to see, how that can be evolved to the next level. So let's say we keep them out of the conversation, and let's say we are really talking about people who are fresh in the field, in the sense that, they have an introduction from technology at one level, or they may have an introduction from the business sense in another, in the sense that they see an opportunity, and then they have also a good idea, either from themselves or through their partners, and they want to jump into this space. So let's say the irreducible minimum is that they have an idea. Let's say that's taken care of. But, at that point in time, most people resort to some amount of self-funding. We ourselves did that. But at the next level, clearly, it goes outside most people's ability to be able to put money into their ideas. And at that level, definitely, like I said previously, it helps to have a certain amount of money, maybe not that much, but a certain amount of money, which is really without these strings attached. Because, it's too early to do anything with the thought, So I think it is a very important attribute that, the no strings attached or a few strings attached is an important attribute at that stage. But to take on what you said after that, let's say it proceeds to the next step, and maybe the next step too, then clearly both these actors, that is the person who's come up with the innovation or the group which has come up with the innovation, and the agency, like say for the example the government, which is invested in being able to encourage innovation outside the corporate circle, which is already anyway doing whatever it is doing, both of them may not have the expertise to take it to the next step. And there you would require a completely different set of actors who bring in all kinds of new thoughts, whether it is being able to analyze markets, being able to look at markets which are not necessarily in front of you but exist somewhere else altogether, background in this medtech space where they understand the evolution of products itself, and there are so many deviations that one needs to make in order to be able to look at opportunities which are emerging at that time and be able to wend your way through that. So completely agree with you that if the innovation cycle can be seen as something where both the people who have the innovation as well as the people who want to fund it see it as more as a relay race, rather than just I own this and therefore me and my great partner are going to take this to the market, that seems to be an nearly impossible task.
Yeah, sorry, Sapna, go ahead.
Add to that because, we've been observing a whole lot of our startup friends as well. And we realized that the evaluation criteria for various stages is sort of not very distinct.
Yeah.
The evaluation criteria and mindset needs to be very different for early stage. There has to be that a space which is between R&D and say take to market, which needs to have a different mindset, needs to have a different set of priorities and and completely something different has to happen in that space. We see that things get killed even before it can take off, because you're already bringing in criteria from a very mature set of businesses, and therefore things just die a very natural death like that.
But Sapna, to this point, if I could ask you a follow-up, I had this moment where I was watching the Paralympics, and to George's point about the relay, the Paralympic relays are entirely different because they each of the legs, at least in some of them, ends up being run by or wheelchair or a blind runner with a guide and so on, right? So there are actually 4 different capability modes that have to be brought together and the race has to be finished, which is quite different from a regular relay where you're looking at acceleration speeds at different phases. So I wondered whether this is a useful metaphor, because in a way the evaluation criteria are entirely different in these 4 modes for the Paralympics. They are highly segmented in their own spheres. But then you have the additional challenge of the overall team has to be made up of 4 exceptional phases, each evaluated in their own right. So leading into that, back to you, Sapna, is cancer one of these kinds of problems? Is it too widely spaced a problem? Is it too complex a problem to think of cancer innovation? Should we as a project or others working in this space think about innovation differently in this space? What does it mean to have innovations in cancer?
If I were to just think of what you said about Paralympics and typical innovation processes, I would think, okay, I mean, even if not broken up into multiple stages, there is ambiguous sort of early stage, and then there is something after. Maybe even if it can be seen as something like that, and not make it into highly granular set of things which are with very distinct kind of criteria. But the early stage is definitely a very distinct stage where the mindset is very different. The kind of talent and the kind of thinking and the kind of synthesis that's required is extremely different. And then there is the later stage where there is a definition, the clear definition of what it is, and then it is more a sort of a developmental process, and at every stage of development, what is it that needs to be done. I feel, I mean, personally, that's my understanding from what we have seen of many of our clients, and we ourselves have kind of gone through. What we have seen is people who invest in this space, and we are talking about the big clients whom we have been lucky to work with, have been able to get some innovative outcomes and some truly sort of breakthrough innovations, because they have sort of patiently invested in the early stages.
And in terms of cancer, for the kinds of work you do, could you give us some examples? I think this would be really helpful for the audience.
Smita, could I just add on to also?
Yeah, please, George.
I think that specifically with cancers, as opposed to some of the other areas of our work, and this is wholly from our own practice and not to be generalized in that sense, is that the technologies which are available just now in terms of early detection, of any of the cancers that we are talking about, they seem to be evolving at such a rapid pace in one way. And also, like I think you briefly mentioned when you asked the question, the area of cancer itself is not probably so easily classified into distinct manifestations in order to be able to pick them up. So essentially at this point in time, we are seeing the normal classifications of, let's say, oral cancer or cervical cancer. But our instinct is that by that time, something has already happened where the innovation has taken a certain form and shape, where probably something earlier has been missed out. So we think that for cancer, it's probably necessary for people like us to be much more closely linked to earlier stage technology innovations in order to be able to sense what are the new things which are happening there, which are probably entirely novel ways in which the diagnosis and then, of course, all the other stages of care, whether it is delivery, etc., which are probably a little bit more understandable. So I think our interventions have been more when it has already taken shape and form. But at the earlier stages where things have been detected, we find ourselves not yet there in terms of being able to access those technologies.
I mean, to that point, someone else we were speaking to was saying that, cancer patients, of course, experience different kinds of suffering even before they realize they have cancer and have been diagnosed. So this challenge, that's not unique to cancer, but it's certainly the case that a lot of the existing work that has been done, whether it's on so-called wars on cancer, the kind of array of diagnostics, devices, therapies that are out there, presume in a way a certain kind of life cycle of a patient. And it may be that in the Indian context, that's quite poorly, still quite poorly understood, which is the point you also made earlier, George, which is that there's a certain kind of empathy and a kind of a philosophical process through which one has to approach what service one is providing. So, Sapna, do you want to elaborate on this issue on cancer?
I think our understanding is that it's a multiple set of things that need to come together, and it practically requires a transdisciplinary, holistic kind of an approach to it. Having been diagnosed with the condition, if it is early stages, the whole understanding that, a hopeful response that if you do go through this surgery and if you follow this, you're not doomed for life, and, it's not fatalistic. And then, of course, if the cancer has progressed quite a bit, what are the other things, other support that the patient requires to sort of understand and participate in his own healthcare and well-being and lead some kind of a positive life. So it's a continuum, and this is what happens with all chronic diseases. But the approach probably still now is that, okay, your biopsy reports came positive, and this is what is the treatment plan, and it sort of gets limited to just the clinical part, and the before and the after, and the rest of your life is all left to the patient to figure out and see what needs to be done. And this understanding also came from the little work that we did on the breast prosthesis, which is the Symmetrics project. And it started with this oncologist in, a very experienced senior oncologist in Bangalore, having studied his own mastectomy patients for 3 years. So he's of course been practicing for many years, and then he kind of observed about 100 of his patients, and he realized that the post surgery recovery was kind of very varied in patients. And he gets patients from, across the socioeconomic classes, and he gets very poor to all kinds of patients go to him. So he started to delve into all the factors that may be kind of affecting their recovery, and then sort of regaining their self-confidence. And he realized that like a post-mastectomy prosthesis is something that is so important, but absolutely not understood. And especially the patients are kind of completely lost as to what they should do about it. And for a woman who's had the surgery, it's a very sort of a deeply personal and intimate and sort of a deeply affecting thing that to have happened to her. And after that, she's a different person. She's a different person, and she does not know kind of what to do about the prosthesis. And of course, then also there are questions about quality and availability and issues of them being retailed through lingerie shops, and you actually need to go and discuss this whole thing with the male salesperson across the counter, and the whole trauma of having to deal with something like this. And that was the genesis of that particular effort. And he came to us saying that, can you design something which is low cost, and there are lots of sophisticated prostheses available from abroad, but people are not able to afford it, and availability is very poor. So can you sort of work on something for us? Initially, our approaches was like, how difficult would it be to, design something like this? So we went about sort of recruiting 10 survivors onto our, think tank, and we worked along with them. We talked to them and heard about all these issues that they have regarding prosthesis. Cost was, of course, one of them, but no knowledge and awareness about what could be done was the starting point. So the first round of solutions we came up with were something very similar to what these imported prostheses were. We thought we could do gel-based prostheses and bring down the cost and make it available through the hospital itself, because then we can. It could be something that, like, when they come for their follow-up checkups, they can come and order their prosthesis. And that was the idea that we were kind of toying around with. So we made about 10 prototypes, and we actually gave it to these 10 survivors to use it for about 3 months. And what we heard back from them was actually completely through us, it really shocked us, because not one of them was happy with what we had given them. We thought that it was looking pretty much like what these imported processes are, and all that. And then we realized that something like breast prosthesis has to be so customized, in the sense that it almost practically all of them found it heavy. Almost all of them said that, it is too sweaty, because conditions are such here. Almost all of them came back saying that I normally wear sari and blouse. So, it doesn't really, I don't feel confident with this when I'm wearing a blouse. And therefore I prefer to just stuff cotton or, paper. And what we really, the research really was telling, and we figured that it has to be highly, highly customized, and it can be lighter, but it can't be heavier. It needs to go with this whole cultural, practice of wearing sari and blouse and these kind of clothing. Of course, functional issues like sweat and all that is a huge deterrent to using something like this. And not using it, of course, is delaying this whole process of you sort of gaining your confidence and, sort of getting integrated back into your normal life and society. And so it was quite a telling research. And so therefore we had to kind of pivot completely and junk all those gel-based ideas and finally we realized that maybe using something like a rapid prototyping technique is what we should explore, because that allows you to tweak some small things and kind of customize it much better, and maybe even with a little bit of size modifications, it can be made to suit the body form better. So we sort of pivoted to a kind of a bellow-like structure made of polymers which are sort of skin friendly, but made through a rapid prototyping technique. And we are sort of wanting to and waiting to develop some more, we would like to work with some material experts and see if we can get something little more, more suitable to the skin and more suitable to long wear, and and more suitable to all this humidity and sweat conditions, because some of the existing materials sort of become harder as you use.
This example you provided, Sapna, and I want to kind of link it back to a point that George also made earlier, which is this relationship with the patient and kind of the new stakeholders that would be required to think of innovations which are really quite focused on people and their lives. I mean, after all, if you or I were in that same situation, we would like to know someone is listening very closely to our experience. So is it that sort of Indian innovation is sort of coming into its own, that we think of local problems as really being important? Is it that we imagine somehow that what our job is here in this ecosystem is not simply tweaking existing products, but trying to also think of lateral use? Your point about materials innovation, the techniques itself of rapid prototyping, perhaps new ways of small batch manufacture, maybe clean rooms. What is it that you think has matured in this sort of 20 plus years? Is it this sort of self-confidence that these problems are not only important, which we always knew they were, but is it that these are problems, at least some fraction of which are rewarded? So that's one question which I will ask. But the second is this kind of patient-centered world, because the life of the patient is not exclusively seen just at a clinic, right? I mean, there's home life, there's work life, there's kind of the urban ecosystem in which they live. So you are adapting the kind of life cycle or the progression of a disease or their sense of well-being with their spatial kind of institutional world. So talk me through a little bit about both of those. Whoever would like to jump in is fine, and then we can wrap up.
Like you said, it's so much a matter of mindsets of everybody involved in the ecosystem, innovators, clinicians, patients themselves, our own awareness of how these things are changing. And perhaps, like when you said, also the rise of a population which is able to pay for more than just clinical services. So probably the consciousness that, what one is afflicted with or one has to deal with, like I think what Sapna pointed out, which is probably the models that we carry with earlier disease structures. It's not an on-off kind of a model, but something that, one probably is going to have to live with for a lifetime, and a progressive consciousness that actually one can do something about this actively.
Especially in the case of, something like diabetes and hypertension and all, where there is a direct connect to lifestyle, that we are already seeing lots of players trying to, address the lifestyle part, at least directly with the patients, and not necessarily sort of confuse it with the clinical side. And not just that, and another area where there is this sort of direct connect with the patients themselves is the mental health area, which I mentioned earlier. So we are seeing that the ecosystem is sort of trying to address the peripheral parts of a patient's problems, not just the clinical, but going beyond that. But I would say very early stages. We are, I think, probably in the last couple of years is where we are seeing all this. A lot more needs to. It's still at a very disconnected level, I would say. Okay, I'll take care of lifestyle issues and let the doctor do what he wants to do for the diabetes, and it is still slightly disconnected. But a problem like cancer, I would think, is got to really have an ecosystem where, along with the doctors and the nurses, there are, I don't know who they are, but there are these other people in the ecosystem who start sort of helping the patient out in their I mean, I shouldn't say journey sounds like in their sort of living through the condition and kind of making their whole sort of coming to terms with the condition, and therefore kind of positively sort of accepting it and living their life. So there is a huge requirement for this other layers that need to come in, and that I'm not sure whether we are yet sort of ready for it or mature, and we are sort of working on it, but definitely there seems to be a big gap there.
Is there more we could do with policy interventions? Is there more, I mean, would you, in the kind of design space, early thinking about it, conceptualization, do you have a wish list that you would like to see more conversations around from policy, the policy sphere?
I mean, one small thing that comes to mind immediately is during our research phase for the diabetes and hypertension, service model innovation. One of the things that we realized is people eat rice, and lots of rice. And rice is available to a family, 30 kilos of rice is available to a family at 1 rupee a kilo. Why would that family, would they even think of not taking that free rice, which is available through the PDS, and think of going and paying money and buying millet and sort of including millet in there. I mean, there are lots of things, but I mean, something like this comes to mind, where there needs to be lots of interventions on the policy side, where it either opens up the available resources, or has different layers of resources available to people, so that if they wish, they can access different things. But there were these kind of very very stark things that we had observed at that point in time.
But could I clarify, Sapna? Did you mean much more policy intervention instead of the prevention, the kind of preventative sphere, in terms of the sort of early lifestyle?
Yeah, somewhere in those lines, like more in the lines of lifestyle related issues, and all these things kind of compound the problem and then lead to a lot of these conditions which are now becoming more and more prevalent. So definitely in this lifestyle diseases space, there is much that can be kind of brought in.
And this goes back a little bit to this question of us as individuals at different income groups having sort of home, work, transportation challenges for services, basic monitoring, or prioritizing health, which is easier, wealthier you become, but it is much harder in other circumstances. George, do you want to add anything? A policy wish list?
No, I think
you must be the two people who don't have an extended policy list.
I was just going to
when
say,
I ask that question, normally everybody says, yes, now that you mention it. Well, maybe you do. Maybe.
no, I was just going to say that we really haven't focused on that area and, understood it much, but I think maybe we should, because
We'll have a follow-up.
More
we
from
do.
that point. We haven't dwelled so much in that space.
Well, it may also be a sign that your niche is actually moving ahead with relatively few bottlenecks. Maybe whether it's the relay metaphor or something else, maybe you are in a space where ideas are flourishing and there really is something new to be had where you can see the gains.
Yeah.
So that's a good sign. I think maybe the others in the other legs will have to think about what to learn from both of you. So Sapna, George, thank you both so much for doing this with us. It's really very generous of you to have spent this time, and I think it will be extremely helpful to our audiences.
Thank you so much, Nita. Thank you.
Enjoyed being here. Thank you.
And so for everyone, we're signing off from the Innovation for Cancer Care in Africa podcast. This is the India team. Thank you for being with us.
Thank you for listening to the ICCA India podcast. Do follow our social media handles and stay tuned for the next episode.